The question is, a 22-year-old male presents to the dental clinic with bleeding gums and mobile upper front teeth. He gives a history that rapid changes in the gums appeared in the last 6 months and has a family history of early tooth loss through periodontal disease. Intraoral examination revealed generalized swelling of the gingiva, good oral hygiene. Gingiva appears pink, free of inflammation, and deep pockets can be demonstrated by probing. Patient is HIV negative. What is the diagnosis? So again, it's a essay type of a question, as in the sense it is a long question, and we need to just skim and scan the most important points. So first is bleeding gums. Second is mobile upper front teeth. Rapid changes in the last 6 months. Family history. Intraoral, over here you can see that the swelling of the gingiva and good oral hygiene. This is again an important point. Pink, free of inflammation is another important point, and deep pockets. So the options are aggressive periodontitis, chronic periodontitis, necrotizing ulcerative periodontitis, and none of the above. So amongst the given options, the best answer is aggressive periodontitis. The reason for this is when you see the comparison between aggressive and chronic periodontitis, over here you will see that the onset, the progression is rapid, whereas this is slow. Second is familial aggregation. Here they had said that the patient reports that there were similar episodes in the family that had occurred where they had loss of the teeth. Third point that you have to see is minimal plaque. That means this indicates that there is decreased inflammation and that the gingival health is good. As opposed to chronic periodontitis. Okay. Now, one of the reasons why it cannot be necrotizing diseases is because NUG or NUP, because they have a very high correlation with HIV patients. However, in the question they had mentioned that the patient is HIV negative. So you can rule out this. Also in NUG and NUP you see very typical interdental craters. The interdental papillae are lost. So there was no loss, as you can see over here, the interdental papillae are typically present. So the answer cannot be NUG or NUP. Now coming to aggressive periodontitis, the 1999 classification workshop on periodontitis showed that there are primary and secondary criteria in order to classify a patient as aggressive periodontitis. There were two features, the primary and the secondary. The primary features includes there is rapid loss of supporting and bone and attachment loss. The patient is otherwise healthy in the sense that the patient does not have any systemic diseases such as diabetes or hypertension, because of which there could be a periodontal manifestation. Third is familial aggregation of cases. These are the three most important criteria. Apart from that, there are secondary criteria which includes inconsistency of etiological factors. That means the patient may or may not present compulsorily a lot of deposit of plaque. Also, the amount of discoloration and calculus deposit also is very minimal. When you take a sample of the whatever plaque that is there, that is a subgingival sample from this patient, and you will see that there is a very strong colonization of AA and P gingivalis. In this patients, there is, since we say that the patient is otherwise healthy, there is a hyper responsive macrophage. That is, the macrophages to whatever minimal plaque is present, they respond much more heavily or much more aggressively as compared to what they would up to other etiological factors, and in the process they cause destruction of the periodontium. Lastly, this is a self-limiting disease in the sense that it occurs and it stops by itself. One of the most important things when we talk about aggressive periodontitis is it is further classified into locally aggressive and generalized aggressive. So localized aggressive, you should remember that there is attachment loss at the incisors plus first molars. That is, you have greater than or equal to two teeth which are affected. In this, you have to remember that when you say greater than or equal to two teeth, the one of which should be a first molar and less than or equal to two other teeth. In generalized, you have greater than or equal to three teeth apart from the incisors and first molars.